from the testimony that we heard, does not sound like it's extremely onerous. Do you know why these problems are occurring? Do you know? Do you have any statistics? Do you have any?
Sometimes collaborative practice agreements, as Dr. Taylor mentioned, do require the nurse practitioner to pay a percentage of her income to the collaborator. And a lot of nurse practitioners do not want to enter into a contract that would financially bind them. So those nurse practitioners, it takes a very long time to find a collaborator.
So it's a money issue.
That the finance is better.
It's a money issue.
At times, yes.
What about the level of care?
The level of care.
We've cited a lot of statistics, and I can tell you the biggest thing that I heard from the doctors was that the problem that they see with this is a lack of supervision, a lack of patient safety, a lack of the ability for NPs to be able to properly diagnose. How do you address that?
There have been many research articles. The IOM report was
before
requested.
That, IOM I discount totally because
okay,
of the
that's what I was getting ready to say. There's
the other research. The other research reports, were they done in areas that had collaborative practice agreements?
Yes, sir.
Well,
we have a meta-analysis of over 30,000 outcomes.
I guess my problem is, we're not seeing any statistics or any differences between the areas that have collaborative practice agreements and those that don't. That's my question. Why is it so important that we eliminate this requirement in the state of Louisiana when the doctors are telling us that it's a good thing for the patients? Other than money. Money is the only thing that I heard today. That's the only thing that you said today that it becomes a reason to eliminate these agreements.
May I speak?
I'm asking the question.
Sorry.
Sure, go ahead.
As far as access to care and the collaborative practice agreement, if a nurse practitioner is willing to open up a clinic in a rural area that is underserved, she has to find a collaborative physician. If there is no one that is willing to collaborate with her, those physicians...
I agree. I hear that. I've heard that several times today. But the doctors are saying that the doctors are available and willing to collaborate.
For a private
visit. The reason that I heard already why we're having trouble signing collaborative practice agreements is because of money. That's the reason that I heard. Now, the doctors are telling me that they're available.
I think
you guys are telling me you're having trouble because of money.
We are having difficulty.
I have big problems voting for a bill that's going to eliminate something that you can't tell me is not less safe.
Yes, sir. Selway 2011 took all of the states who had already removed barriers to practice and found no increase in malpractice rate, and in some instances reduced the malpractice rate. So we do have evidence revealing it's safe.
What is Selway?
Selway was a research, was done by the University of, the Catholic University in D.C.
Well, again, I have to read that report.
I can't remember that right off the top of my head.
Just like the Institute of Medicine, it's the same kind of deal. What do they say? Damn lies, and statistics. I've heard one thing today, and I've heard money. And that, to me, is no reason to eliminate the requirement that doctors collaborate, not supervise, just collaborate with a nurse practitioner.
I'm sorry that you feel that way. We have other research articles that state...
Well, you haven't shown
please.
Well,
Institute of Medicine,
showing
National Council of State Boards, National Health Policy Forum, the Macy Foundation, New England Journal of Medicine, and Journal of Family Practice all recommend removal.
Thank you. Representative Harris has a question.
Real quick,